Three common blood pressure medications are sitting in medicine cabinets right now, and for adults over 60, they may be creating hidden risks. Not because they don't work, they do lower blood pressure effectively. But in older adults, managing blood pressure is only part of the story. The other part, which often gets overlooked, is how these medications affect the body in ways that can lead to serious complications, including emergency situations. If you or someone close to you is taking blood pressure medication, what you're about to hear could be some of the most important health information you come across this year. Stay with me. I'm Dr. Victor Selenus, and this channel is dedicated to adults over 60 who want clear, honest, evidence-based health information, explained in a way that actually makes sense. We break down the latest research so you can have more informed conversations with your doctor and take greater control of your health. Consider subscribing so you don't miss future updates. Now, let's get into this, because it matters. The first group of medications to be aware of is called alpha-1 blockers. You might recognize them by names like Cardiologist, doxazosin, or Catapres, prazosin. These drugs have been used for decades to treat high blood pressure. They work by relaxing blood vessels, allowing blood to flow more easily. On the surface, that sounds ideal, and in younger adults it often is. But here's where the concern begins. Alpha-1 blockers can cause a condition known as orthostatic hypotension. Orthostatic refers to standing up, and hypotension means low blood pressure. In simple terms, when you stand up from a chair, bed, or even the toilet, your blood pressure can drop suddenly. In younger individuals, the body quickly adjusts within seconds. But after age 60, that response slows down. For a few critical moments, the brain may not receive enough blood flow. Lightheadedness or even fainting can occur, and in many cases, this leads to falls. Research published in the Journal of the American Medical Association found that medications causing this type of blood pressure drop were linked to a 45% higher risk of serious fall-related injuries in adults over 65. We're talking about hip fractures, head injuries, and hospital stays. Because of this risk, the American Geriatrics Society has placed alpha-1 blockers on the Beers criteria, a list of medications considered potentially inappropriate for older adults based on strong clinical evidence. And this isn't just theory. It shows up in real lives. Take Harold, a 74-year-old retired electrician. He had been taking doxazosin for nearly 3 years. At every checkup, his blood pressure looked perfect, and his doctor was satisfied. But Harold had been experiencing dizziness every time he got up during the night. He thought it was just part of aging. One evening, he stood up from his chair, and his blood pressure dropped too quickly. He fell and fractured his hip. Recovery took 8 months. After his medication was switched, under medical supervision, the dizziness disappeared within days. That's what those statistics really mean. Now, the second medication you need to know about often surprises people. It's called Clonidine, sold under the brand name Catapres. Clonidine works differently. Instead of acting on blood vessels, it lowers blood pressure by affecting the brain and central nervous system. And that's where problems can arise in older adults. Its side effects can include sedation, mental slowing, fatigue, and even depression. In many cases, these symptoms are mistaken for early dementia. Patients may be referred to specialists, families become concerned, and extensive testing is done, without anyone initially considering that the medication itself might be the cause. A 2022 study published in JAMA Internal Medicine found that older adults taking centrally acting blood pressure medications like Clonidine reported significantly higher levels of cognitive issues and depressive symptoms compared to those on other treatments. In plain terms, these medications can make people feel mentally foggy, slowed down, or even depressed, sometimes to the point where it's mistaken for early dementia. In reality, the issue may not be the brain at all, but the prescription itself. But what's even more concerning is what happens when Clonidine is stopped. Stopping Clonidine suddenly is not just risky, it can be dangerous. This medication is known to cause what's called rebound hypertension. If the drug is discontinued abruptly, whether you miss a dose, run out of medication, or decide to stop on your own, your blood pressure can spike and dramatically. In some cases, it can rise higher than it ever was before treatment began. These spikes have been linked to serious events, including strokes and hypertensive crises. There are documented cases of patients experiencing severe complications simply because they missed a single dose while traveling. For older adults, especially those who may occasionally forget medications, this rebound effect can be life-threatening. Because of these risks, the American Geriatric Society's BEERS criteria specifically advises against the use of Clonidine in adults over 65, citing both its effects on the central nervous system and the danger of rebound hypertension. Despite this, a 2021 review in Pharmacotherapy estimated that nearly 8% of adults over 65 with high blood pressure in the United States were still being prescribed Clonidine. That represents a large number of people facing a risk they may not even be aware of. Let me ask you directly, are you currently taking Clonidine or doxazosin? You can simply answer yes or no. Understanding what people are actually taking helps bring clarity to how widespread these issues are. Now let's move to the third medication, because this one often creates confusion. It belongs to a class called calcium channel blockers, a group of drugs that are generally considered safe and effective for older adults. However, there is one specific form that raises concern: immediate-release nifedipine, also known as short-acting nifedipine. You might recognize it under brand names like Procardia or Adalat. Here's the issue. Immediate-release nifedipine lowers blood pressure very quickly. When that drop happens too fast, the body reacts by increasing the heart rate to compensate. This response is called reflex tachycardia. In a younger, healthy person, this may just feel uncomfortable, but in older adults, especially those with even mild stiffening or narrowing of the arteries, which is common with age, this combination can reduce blood flow to the heart itself. The result can be cardiac ischemia, meaning the heart muscle isn't getting enough oxygen. In simple terms, this rapid drop in blood pressure, combined with a racing heart, can actually trigger a heart attack. The FDA has issued warnings about this exact mechanism. The BEERS criteria also lists immediate-release nifedipine as potentially inappropriate for older adults due to the risks of sudden hypotension and reduced blood flow to the heart. A 2023 review published in Age and Aging, which examined medication-related hospitalizations in adults over 65, found that drugs causing rapid and significant drops in blood pressure were among the leading causes of preventable emergency admissions. And that word, preventable, is key. Now, it's important to be clear here. Not all medications in this class are a problem. Long-acting, extended-release versions of nifedipine and other calcium channel blockers like amlodipine, Norvasc, are generally safe, well-tolerated, and commonly recommended for older adults. The concern applies specifically to the immediate-release, short-acting form. If your prescription label says immediate release, short-acting, or simply lists Procardia without mentioning extended release, this is something you should pay close attention to. So what should you do next? Start by writing down every blood pressure medication you're currently taking. Include both the generic and brand names if possible. Then check your list for the following: doxazosin, prazosin, Clonidine, and immediate-release nifedipine. If any of those medications show up on your list, the next step is simple. Reach out to your prescribing doctor or speak with a pharmacist and ask for a full medication review. Do not stop taking any blood pressure medication on your own. This is especially important with Clonidine, where stopping suddenly can trigger dangerous spikes in blood pressure. Any changes should always be done gradually and under medical supervision. When you talk to your doctor, you can use a clear and respectful approach like this. I've read that this medication is listed on the American Geriatric Society Beers criteria for older adults. Can we discuss whether there might be a safer alternative for me? That wording shows that you're informed and proactive, not difficult, and it opens the door to a meaningful clinical discussion. The good news is that there are several well-established alternatives your doctor may consider. These include ACE inhibitors such as lisinopril, ARBs like losartan, thiazide diuretics such as chlorthalidone, and long-acting calcium channel blockers like amlodipine. For many adults over 60, these options are effective and generally well tolerated. If you're currently taking any of the medications we discussed and have noticed symptoms like dizziness when standing, unusual tiredness, mental fog, or anything that just doesn't feel normal for you, don't ignore it. Bring it up with your doctor, sooner rather than later if the symptoms are concerning. These aren't side effects you simply live with. They're signals your body is giving you, and they deserve attention. One more important point. If you're 75 or older, it's worth having a specific conversation with your doctor about your blood pressure targets. Research, including findings from the SPRINT trial, suggests that ideal targets for older adults may differ from standard guidelines. In some cases, lowering blood pressure too aggressively can increase the risk of falls or affect kidney function. The goal isn't just to lower your numbers, it's to find the right medication at the right dose, aimed at the right target for your body. You deserve all three. Before you go, take a moment to reflect on what you've heard. If you're planning to review your medications today, say, "Reviewing my meds." If you'd like to share your experience, you can mention your age and what you're taking. And if you know someone who could benefit from this information, consider sharing it with them. If you find this kind of clear, practical health information helpful, stay connected so you don't miss what's coming next. In the next discussion, I'll be covering a key mineral that many adults over 60 are lacking, one that quietly influences blood pressure from within and the specific form your body can actually absorb. I'm Dr. Victor Selenus. Your health in your 60s, 70s, and beyond deserves clarity, solid science, and the confidence to ask the right questions. Take what you've learned today, talk with your doctor, and make decisions that truly support your well-being.